next up, we have Pierre Stefanuto from University of Liège. He's lead scientist and lecturer at Liège University in Belgium. His main research interest is development of analytical solutions based on chromatography mass spec technology. He's currently working on development of multimodal solutions of untargeted screening of small molecules. He's developed a strong expertise in multidimensional methods to increase resolution power and is interested in development of statistical models for method optimization and data handling. Thanks, and over to you.
Good morning, everyone. It's a pleasure for me to be here today and to take part to the Breast Biopsy Conference. Today, I will be speaking about induced inflammation on in vitro lung model. So let's start. Our main focus in the University of Liège is the study of inflammatory disease. And more especially, we focus on lung inflammation and we try to characterize this lung condition through exhaled breath analysis. So one of the most common chronic lung inflammation is asthma. And even if everyone already heard about asthma, it's still a major health concern. So we see an increase in asthma, and this is due to many reasons. It's our lifestyles, the air pollution, climate change effect, and with the rise of the population and an increase of the screening in emerging countries, we see that the asthma population is increasing too. And what is a big concern is the fact that a lot of children are affected with asthma, and it really impacts the quality of life. Moreover, asthma is a chronic disease, so you cannot cure asthma. So it has a huge impact on the healthcare cost. So in Europe, we spend about 20 billion euros to treat asthma symptoms. And it's crazy to think that 20% of the patients receive the wrong medication just because asthma is a disease with different phenotype, and it's still really difficult to fix a phenotype to a people because of the accumulation of too many symptoms in the disease. So in 2019, we published with the Maastricht University our breast print study. So we already presented those results at the first breast biopsy conference, where we screened in 2 phases more than 500 patients, and based on a small set of biomarkers, we were able to differentiate asthma phenotype. So the take-home message from this paper was the fact that with a set of 5 biomarkers, we were able to correctly identify eosinophil phenotype, as well as we do with pheno and blood cell count, which are 2 common use techniques. So we were as good as them. And what was really interesting is the fact that combining those techniques, so it's the green line on the OROC curve here, we were performing even better. So breast is really an added value for monitoring asthma. And when you look to the compounds that we identify, you would see that it's compounds that are not like surprising for people working in breast analysis. But here we have to keep in mind that we started with more than 500 patients, 700 VOC, not features. So this was like 700 like compounds present in all those chromatograms. And from there, we had to identify those 5 and validate the chemical identification, which it's the key. And it's a fighting ground for the breast community is to make sure that we properly identify those compounds. So from there, it was a nice discovery. So we decided to go on, and now we are working towards implementing those markers into clinics using different techniques. But the big question is, where are they coming from, and can we extract more information from those 5 identified markers? So we start to look to the origin. And when you speak about inflammation processes, you discuss about oxidative stress. So oxidative stress, like in the breast publication field, it's usually mentioned, but it's not yet really investigated. So of course, we know which factor will trigger oxidative stress in the lung because it's studied for years, but we know that it will affect the lipids and produce VOC, but there is no real identified pathway to say, okay, this lipid follow this metabolic pathway to generate this VOC. So we design a research vision in the group where we try to combine different omics methods to properly identify those metabolic pathways and see which compounds are really coming from a specific pathway and detecting the breath. And today I want to focus on the VOC part of this multi-omics screening. So for most of this omics application, we use multidimensional chromatography just because we have an enormous separation resolution and we have identification criteria. So multidimensional chromatography offers you like 2 dimensions of chromatographic separation in addition to mass spec identification, which can be high resolution mass spec. So at the end of the day, you have a multi-factor identification of compounds with electron ionization fragmentogram that you can screen with the NIST that give you a good starting point. We have exact mass to go deeper in the mass spec identification, but we also have chromatographic identification criteria like GC and GC-GC elution pattern. And based on that, if the compounds has not too much isomers, which is usually the case with VOC, we can reach level 2 on the MSI identification level. And from there, you can purchase the standard of the putative candidate and confirm the identity. This is the process that we follow for the breast print study. So to identify this pathway through GC-GC, we need samples. And of course, breast is one of them, but when you want to look to the precursor of the VOC in the breast, you need something coming directly from the lung that contains the larger molecule that will degrade through oxidative stress and produce the compounds of interest. So that's why we focus on exhaled breath condensate, bronchoalveolar lavage, blunt bronchial aspirate, sputum analysis, and in vitro model. So our approach is how to use directly ex vivo sample, like we did with the group of Jane Hill, no UBC, but at that time it was in Dartmouth College, where we studied the bronchoalveolar lavage from transplant patients. But we also have really in vitro model where we try to really simulate what's happening in the lung in vitro using lung epithelial cell. So the results that I want to discuss with you today are part of this paper published in Analyst, where we really set the groundwork for our in vitro lung inflammation model. So the main focus, because we are analytical chemists, was to make sure that any model that we develop, we can combine it with all our multi-omics. Because if we have a model and we cannot really analyze the content with the method that is the most adapted, we are not reaching our goal. So it's really important for us to focus on that. So we select epithelial cell to start, a commercial cell line, and it's just because it's easy to grow. So we wanted to make sure that we were safe on that side. And after, to generate oxidative stress, we use hydrogen peroxide, but we also use biological stress using sputum from asthma patients and healthy individuals. And we spend a lot of time thinking and brainstorming about the design of the study. Because when you start to go in modeling, you have so many factors affecting the VOC content. And you can see that basically for like 2 inflammation conditions, chemical and biological, and a positive control, we had 8 different control of the environment and the physicochemical condition. So you can see here on the PCA that we really have a first differentiation with no supervision at all between the cell content and the media content. So in green, you have that all the samples that contain no cell, and in red, all the samples containing cell, regardless of the stress. And you can see that we have this first vision that what we would expect, like you have biological activity in one of them. And this contains the biological controls. That means that we have control of the cell metabolism. We have analytical control, so we have control of the instrument, and we have physicochemical control, because here you speak about liquid media producing VOC. So the physicochemistry of equilibrium between the volatile and the solution, it's important to control. So pH, saline content, everything will affect the amount of VOC that you will release from the liquid and go to the gas phase. So this is the type of setup that we had, where we had the cell, we have a different exposition time, different concentration of the chemical agent, and our control. So even if the question is pretty simple, you can see that by trying to cut all the corner of possible deviation, we arrive with a really large number of samples to analyze. And the method that we used for that was using SPME on half a milliliter of media. And because of this design, we had an easy route for the data processing, because for each condition, we had multiple matching control that were allowing us to remove signature coming from the sample. And by simple tests like one-way ANOVA and fold change, we were able to arrive to a list of compounds that were really produced by the tracing condition that we could visualize using PCA and HCA. So with this proper control that we can do, because we are not speaking about clinical sample, we were able to really use a straightforward statistical processing with no like really fancy machine learning or anything, but that was sufficient for answering the question that we asked. So as I say, we evaluate different things like exposition time and exposition concentration to the stressing agent. Here you have the cell viability test for the H2O2 at different concentration. And we really focused to make sure that we had conditions that were not affecting cell viability. So here we selected 0.1 millimolar during 60 minutes. So you see that there is non-significant change in the viability, but we could see on the PCA that we were reaching oxidation. So here it's really one of the most interesting PCA that we generate in this study. You can see clearly that when you kill the cell by putting a high dose of H2O2, you kill the cell, so you have apoptosis signature. When you have different level of H2O2 generating oxidation at different level, you have an oxidation cluster where you see the difference between the two concentration. And we have our control on the top. So PC1 is discriminating the apoptosis, and PC2 is discriminating the oxidation level that we reach. So it's really informative visualization of what's happening in the cell. So taking advantage of GCGC of MS, we identified the main chemical family. And for people working in breast, like this is usually what you are used to see when you have oxidative condition in your sample. So a lot of hydrocarbons that you are usually a pain because they are really complicated to identify. Alcohol, ketones, aldehyde that are all coming from lipids peroxidation. So this is really what we wanted to obtain, is to see that we were able to generate the chemical reaction producing the VOC that we see in the breast. So it's really oxidative stress signature over there. So it's working well on the chemistry, but we are just simulating the oxidation condition. Now we want to see what's happening with the biology. So we pull the supernatant from sputum coming from 25 asthmatic patients, that is our inflammatory sputum, and from 8 healthy individuals. And we started the same process that we did with the H2O2, and here the results were really interesting. So we see that with exposure time and sufficient sputum exposition, we start to see cell overproliferation. So we were overproliferation of our cell in the contact of inflammatory sputum. And this is really important because this is what we see in the lung. So the MD were telling us, okay, this is what you see in the lung, that the cells are growing faster than they should in normal lung. So we were able to reproduce this effect of the metabolism. So we focused really on the concentration and the exposition time that was giving us really like this difference between the two conditions. And of course, we checked this condition with the non-inflammatory sputum just to see if it was not just the sputum content in general that was like prion for the cell. And you can see that there is nothing significant. So it's really the inflammation signature that is producing this proliferation of the cell. So again, our model is evolving towards what we see in vivo. And this is a nice heat map of visualization. So here it's the 100 VOC that were coming from the inflammatory sputum. And you can see something interesting on the left where you have the cell line plus the inflammatory sputum in dark blue, where you see that a lot of overexpression of the compounds. So it's really like the inflammation signature coming from there. And you see that next to that, we have the H2O2 cell, and we have also an overexpression, but not exactly the same compounds are overexpressed. So the stress conditions are mimicking, but not reproducing the biological stress. And after we have our cell, and we see that basically our healthy sputum is really close to the cell with PBS. So this is kind of just a dilution effect, I guess, when you put healthy sputum. And this is really similar to just like spiking PBS over there. And this is like some of the features that were really like affected by the oxidative stress condition. And again, if you go through the table, you will identify your usual suspect like non-anal. So non-anal was one of the compounds that we identified in our breast sprint study where we were focusing on asthma. Octanal and hexane 3-ethyl, it's compounds that we identified in bronchoalveolar lavage from transplant patients. So this is something that ring a bell for us. So we didn't identify and validate identification of all those compounds, but still we are getting closer and closer to really understand what's happening there, even if there is still a lot of work to perform. So my take-home message about this presentation is, for me, the future of exhaled breaths require more fundamental understanding. So at the beginning, when I started in the field, I had the feeling that we knew about oxidative stress, so there was not really requirement to take care of that. But we need to go until the VOC production and understand really the metabolic pathway, but also the equilibrium between the cell membrane and the headspace, between the fluid in the lungs. So there is already a lot to understand around what's happening really for compounds to emerge from the lung and arrive in the exhaled breath. In vitro inflammation modeling, it's a key player to implement multi-omics workflow. As I say, if you want to do multi-omics, you have to make sure that the model is compatible with the technique that you want to use afterwards. And to be compatible, you need to design the model for that. So it's really important to have in vitro model because you can produce high volume, you can fail multiple times to produce your model without losing like valuable patient sample. Volatile metabolomics as a seat at the table for multi-omics screening. So I guess here it's not like that I have to convince you, but clearly in the metabolomics community, we have to go towards this really small molecule end of the line of the metabolic pathway to really understand the origin. And I want to stress that again, a robust design will always be the key for meaningful information and to make sure that you are generating a building block for something else and not just a study that is not really useful for others. And I just stealing like 30 seconds here to advertise. If you're interested about those type of analytical approach that I present you today, we are hosting a workshop in Liège early 2023. Everything is free, so don't hesitate to register on the webpage. And with that, I want to thank you all for your attention, and I will be really happy to discuss with you about this presentation. Thank you very much.
Brilliant. Thank you so much for a wonderful talk. If you're able to unmute and share your camera, that'd be great.
Hello.
And I can hear you. Fantastic. Well, thank you so much. I always enjoy your presentations. I think they're absolutely fantastic. We've got a good few questions coming in already. So the first is, did you consider using cytokines, interleukins like IL-4, 5, 13, which are otherwise involved in manifestation of asthma for inducing oxidative stress in your in vitro studies?
That's a really good question, because for now, when we designed the study, we focus on 25 patients with allergic asthma. So we knew that they will have like a really complex sputum with a lot of mediator inside. But of course, now the next step there, it's since we have different type of asthma, we need to have different type of pool of sputum to make sure we mimic the different phenotype and the different content. And adding to that, now we were just using sputum that is characterized by cell counts for inflammatory cell, but we want to go one step further and also have a comprehensive analysis of the sputum content to know, okay, with this type of asthma, we have this type of molecule that provides this type of VOC. So to go to pathway elucidation, we need to also characterize that. And in there, we will see if some type of sputum phenotype has higher level of cytokine, or maybe like different way of recruiting inflammatory cell. So we need to go for full characterization, of course.
Fantastic. Next question was the apoptosis induced by 50 micromolar or 10 micromolar of the hydrogen peroxide? The PCA and bar graph are different.
Yeah, so both are doing the same. So 10 micromolar, it's enough to kill. And of course, with 50, it's going much faster. But at the end, when you look to the VOC profile, it's kind of overlapping because when the cells are dead, they are dead and nothing is really changing the VOC content over there. So if you want to reproduce the experiment, and kill the cell, like with 10 micromolar, it will be enough. And if you put 50, you will obtain something really similar.
Brilliant. There's a few questions which relate to moving from in vitro to in vivo. So mention you're now looking at implementing your asthma markers in the clinic. What does this look like for you? Are you doing breast sample analysis with the same technologies to translate?
Yeah. So basically, we have two parallel goals. So for now, we are not exactly trying to translate what we are doing in vitro, in vivo, and vice versa. We are just trying to better understand what's happening. So there is a lot of study in the literature. Also, people know have the technology to sample breasts, analyze the breasts, and see that there is differences. And this is great. But I think to go one step further, we need to understand. So if you do the job and you validate the compounds, you say, okay, this might be your target in the breast, but where it's supposed to come from. So you need to study the fundamental biology there. And as I try to communicate in my presentation, there is so many parameters to change. So how to generate the same activation of the metabolic pathway, but also understand the trip that your molecule is taking from the point where it's generated to the sampling in a tubes or in a bag. So for there, you need like in vitro modeling. So we do in vitro modeling to understand what's happening in the lung and how we can control different parameters. But in parallel of that, we continue to do like ex vivo, like exhale breath analysis from patient and trying to generate, I would say, a clinical product, but with a strong background saying, okay, I know that when I have inflammation, I have disactivation. That's probably the reason why I see these compounds. But I think we are not there yet to see, oh, I see non-anal in the breast, it's coming from there and I can quantify it in my cell line and it's related to the breast. Like, I think it's still like a really like brilliant objective, but we are not there yet.
Got it. That makes a lot of sense. I suppose as well, if you have that understanding, some target compounds when you're designing the in vivo breast study as well, it's an easier experiment to run as opposed to doing your classic, untargeted analysis if you're going to directly test a hypothesis with a small number of compounds.
Yeah, and as I say, like the point of having in vitro is you can fail a lot and test different hypotheses, and after I think you can move up. You can do like as Frederican was showing, like I'll say, now that I have this information, I can build up a really nice mice model, and after like from the mice information, I can maybe move up to human experiment.
Got it. Thank you. And then just last question. So you mentioned you're capturing a sample from spemy fiber above the plates. Was there any kind of concern or worry of headspace cross-contamination between the different wells? Did you have to design a specific jig to deal with that issue?
Yeah, so basically, like this is part of our control. So we have in the well plates, we had the control, and so we were having the same control in different locations and seeing that basically the control to control distance in our separation space was almost non-existent or linked to the technical variation. And we see that basically there is not too much like movement of the VOC over different wells.
Excellent. Well, thank you so much again for a wonderful talk. I really enjoyed that. I know all the listeners will as well.